Let's review how different maneuvers affect cardiac murmurs. Valsalva maneuver decreases venous return during straining, increases it during relaxation. When venous return drops, murmurs of mitral valve prolapse and hypertrophic cardiomyopathy get louder because left ventricular volume decreases. Most other murmurs soften because flow across the valve is reduced. Abrupt standing also decreases venous return and preload. MVP and HCM again get louder, while most other murmurs become softer. MVP and HCM-A. Squatting increases venous return, left ventricular volume, and afterload. Most murmurs become louder due to increased flow. However, MVP and HCM become quieter because the left ventricle is fuller, reducing obstruction or prolapse. MVP and H. Passive leg raise increases right and left ventricular volume, mimicking squatting. Most murmurs intensify, but MVP and HCM become quieter. Hand grip increases afterload and left ventricular volume, causing reverse flow across the aortic valve and increasing regurgitant fraction. This makes left-sided regurgitant murmurs, like aortic regurgitation, mitral regurgitation, and ventricular septal defect, louder. Aortic stenosis softens, and both MVP and HCM become quieter. Aortic stenosis so. Inspiration increases venous return to the right heart and decreases it to the left heart. Right-sided murmurs like tricuspid regurgitation or pulmonic stenosis become louder, while left-sided murmurs soften.